Welcome back to Western New York Living. I'm sure a few of you have heard the phrase, "you're a pain in my butt." Now, if I say it to my producer, Cleve, as I do all the time, it's a joke. But when you have real pain in your knee, it's no laughing matter. And my next guest is an expert at treating knee pain and problems. Joining us now from Excelsior Orthopedics is Dr. Andrew Stoeckl. Thank you so much for being here. I know knees and shoulders are your specialty, so I'm excited to talk about this. Some of the common causes and treatments for knees and knee pain. Let's start there.
Well, knee pain can be caused by a multitude of things. When you're talking about knee arthritis, the lining of the knee is called articular cartilage, and as that wears or deteriorates, it causes pain. But there's a lot of other causes of knee pain. You can get tendinitis or meniscal tears.
And if you have knee pain, it's important to get it looked at, isn't it? Because you could do more damage.
Certainly, especially once the pain crosses the point where it's annoying and starts to interfere with your quality of life, activities of daily living around the house, at work, at the gym, then I think you're right. I think it's important to get it looked at, get it diagnosed, and come up with a logical treatment plan for it.
A lot of times you hear people are getting total knee replacements. Tell me who are candidates for that.
Well, total knee replacement it's kind of the last stop on the railroad for knee arthritis. So by the time people get to that stage, they've usually had pain for a significant period of time. It's pain that's severe enough that it interferes with their quality of life. They've probably been through multiple treatment options, including weight loss, activity modification, non-steroidal anti-inflammatories, potentially injectable medications, which could be either a steroid, commonly referred to as cortisone, or a visco supplement or a gel shot. And when they go through all of those things and they stop working well and their pain's interfering with their quality of life, then they become a candidate for a knee replacement. At
Excelsior Orthopedics, you have an outpatient joint replacement program. I love the way you're doing this. Can you explain how you work it?
Sure. In the traditional, historically, knee replacements have been done in a hospital. Some people are able to go home after several days in the hospital, but a lot of people actually spend several days in the hospital and then go to a subacute rehab place. In other parts of the country, people have sort of pioneered the concept where for a select group of healthy, motivated people, maybe we can do it at an outpatient surgery center. And we've started doing that beginning the first of the year, where essentially we perform your knee replacement at our Excelsior Orthopedics outpatient surgery center. And then instead of sending you directly home, we admit you to a recovery suite, which is essentially an apartment staffed with a registered nurse and a physical therapist, and you spend 2 nights there to get your rehabilitation process off to a running start. And then when we're confident you're doing well there, we transition you to home.
And that must be a much nicer, more comfortable way to go through that rehab process.
It is. I mean, hospitals do great things, but there's a certain subset of patients who get knee replacements who don't need all that a hospital has to offer. And they're better served with the more comfortable environment of a surgery center and a recovery suite. You know, the food is ordered basically like room service. You know, the nurses it's a one-on-one nursing experience, which unfortunately hospitals aren't able to provide anymore.
And from 20 years ago to today, how far have we come with knee replacements and the technology?
I think we've come miles. You know, the implants themselves and the technology around them has certainly come miles. I think the techniques that we use to install them has improved a lot. And for me personally, one of the most exciting things in knee replacements has been the way we're able to control pain around the perioperative pain that patients experience. And I think probably that ability to adequately control pain is one of the biggest things that's allowed us to move these into an outpatient setting.
And we're going to have to stop there, but thank you for this great information. Nice to have you on the show.
Thank you.
If you're suffering from knee pain, it is time to get to Excelsior Orthopedics and see how they can help. They have 3 locations, and Dr. Stoeckl works out of both the main campus and Amherst and their Orchard Park site. To find out more about Excelsior Orthopedics, I suggest you head right over to their website, excelsiorortho.com. If you specifically want to find out more about how to treat your knee pain, go to the New Joints Now. Go to newjointnow.com. Their main phone number 250-9999, or you can call 250-6513 to speak to someone more specifically about your knee pain. If you suffer from knee pain, get to Excelsior Orthopedics. Well, that's all the time we have for today. Thanks for joining us, and remember to honor those who gave their all for our country. Fly your flag this Memorial Day weekend. Have a safe and happy holiday, and we'll see you next Saturday. Bye-bye.
This segment of Western New York Living was sponsored by Excelsior Orthopedics.